Hi, my name is Kareen, and I'm a level 1 nursing student, and my
Hi.
clinical instructor has assigned me to observe you today.
Great. Feel free to ask me any questions.
Thank you so much. I look so forward to learning a lot. So you're taking care of the patient in room 529. Do you have a chance to give me a report?
Sure. Room 529 is patient Marta Yarn. She's an 80-year-old. She presented with a stage 3 pressure ulcer on her sacrum. She's widowed and lives alone. Right now she's experiencing a lot of decreased appetite, and it's a non-healing sacral ulcer, about 4 centimeters diameter, 1 centimeter depth. It's been covered with a hydrocolloid dressing per the doctor's order. Right now she's ANO times 4, cooperative. She's a little anxious. Pain is a 6 out of 10. It was 6 out of 10. We did administer her an opioid, so she's okay now. She has full range of motion. She is on a regular diet, but as of tonight she will be NPO because she's getting a surgical debridement. She's experiencing increased fatigue and weakness. She has clear heart sounds, lung sounds. Her pulses are all +2. All her sounds in her abdomen are good. They're all active. She's had lower back pain for the last 3 months. She did state acetaminophen helps her. And she does have a history of multiple admissions for community-acquired pneumonia, so we definitely want to check her vitals every 4 hours, make sure she's not developing that pneumonia again. And we're going to be administering some medicine very soon for her. Any other questions?
Wow, thank you so much for giving me a report. Now, do you mind if I ask you a couple questions regarding the medication you're going to be giving and
Sure.
what you give it to her?
Mm-hmm.
Okay. Why specifically is she receiving this medication?
Well, she does have not only a history of pneumonia, but she has a current infection with her pressure ulcer. And this medication inhibits the bacterial protein synthesis. It's a bactericidal, so it will kill that infection.
So that's the action it has on the body?
Yes.
Gotcha. Now, when should we question administering this medication?
We want to make sure, she has received it before, so we know she's not hypersensitive to it, so
Okay.
that's okay. But we do want to check her renal function and make sure if she has any pre-existing hearing loss. Definitely want to watch out for those.
Now, does this medication have a therapeutic serum level?
No.
Okay. And which vital signs must be monitored?
We want to assess her temperature, or her level of consciousness, watch her mental status changes, and make sure she doesn't have any febrile seizures.
So those are also the psychological ones too?
Yes, they are.
Okay. Now, what interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
We want to make sure that she's aware she receives this medication every 8 hours, so she knows at that 8-hour mark to let us know if we don't already come in with it. But she also needs to watch her IV site, make sure it's not developing swelling, redness. If she's having any pain, she needs to be able to tell us that.
Gotcha. And what about interventions at home?
Home, she needs to take her temperature, make sure her fever doesn't go above 100. Make any level of consciousness changes, so if she's dizzy, if she has difficulty breathing, she experiences swelling or itchiness, ringing in her ears, and any sort of wheezing, anything like that, she definitely needs to call her doctor.
And what are the side effects?
Pain and inflammation at the injection site, rash, fever, nausea, diarrhea, dizziness, tinnitus, anaphylaxis is a big one, nephrotoxicity, irreversible ototoxicity, and superinfections.
And how do you know this medication's effective?
That the infection goes down in her.
All right.
Any more questions before we go on and administer the medication?
No, thank you for answering my questions.
Not a problem at all. It's important to know your patient and the medication you're administering to keep them safe. Hi, Mrs. Yarn.
Hi, Heather.
Hi, I'm going to be administering your antibiotic today, and I have a level 1 student with me. This is Kareen.
Hi.
Are you doing okay?
Mm-hmm.
Okay. And Kareen, you want to make sure you pull up your MAR.
Okay.
And we're going to be scanning our first bag with sodium chloride with potassium chloride.
Okay.
So you want to get that all set up and ready to go so you can scan.
Okay.
All right, Miss Yarn, do you have any pain at your site here?
Mm-mm.
You doing okay? No swelling?
Mm-mm.
All right. So we want to double check our medicine against our MAR. Okay.
Mm-hmm.
Everything matches. All right, and Miss Yarn, what's your date of birth and your full name?
Marta Yarn, 1148.
Okay. Okay. And we want to scan our medicine, okay?
Mm-hmm.
This is our sodium chloride.
And Heather, I didn't have any allergies like last time. None.
Okay, good. I was about to ask you. Great.
You always
No nut
ask me.
allergies.
Mm-mm.
Alright, so got it already here. It wants the site, and it's her right dorsal metacarpal. And we want the time we're administering it.
It's 15:05. I know you guys like to chart in military time.
Yes, we do. Thank you very much.
Mm-hmm. It's not my first rodeo.
Okay, and then we want to document what dose we're giving.
Okay.
Sodium chloride, okay, and it's at 125 milliliters an hour. Okay. Initials. We always want to make sure we inspect the bag as well at the beginning to make sure it's clear and that it has not expired, which I already checked, it has not. Alright, now we want to pull up our gentamicin. Okay. And we already asked her name, date of birth while we were in here, so it's okay.
Mm-hmm.
So, scan twice. When it does that, you just redo it. Then we're going to scan our medicine, the gentamicin, antibiotic. Okay. I'm going to double check the bag. It's clear. It's also not expired. Everything looks good. And we're going to be giving that IV piggyback. It's going to be every 8 hours, okay, Miss Yarn?
Mm-hmm.
Alright. And we're going to document also what we're giving. We're going to give it at 80 milligrams per 100 milliliters. We're giving it also in the right. And your initials. Alright. Let me go ahead and get my gloves on real quick. And you always want to make sure that you administer it before you actually save your notes. You always want to give it before, that way you don't forget, okay?
Mm-hmm.
Gloves don't like me today. Okay. You always want to make sure you scrub the hub for at least 10 seconds, okay?
Mm-hmm.
Okay, make sure neither touch anything else, okay?
Mm-hmm.
Otherwise it will make it unsterile. Luckily, it did not touch the table. But be very careful when you do this. Always hold on, okay?
Mm-hmm.
Alright. I'm going to go ahead and turn the machine on, okay? It's not a new patient. I'm going to select no. Yes, medical, surgical. And channel select. Guardrail.
You hit guardrail because it's an IV piggyback?
Mm-hmm.
Okay. Thanks, Heather.
You're welcome. The Genta we're giving 800 milligrams per 100 milliliters. It's already right here, so we're going to select that one. Sometimes you have to put it in manually. Asking if that's correct. And hit next to confirm it. I'm going to go ahead and unclamp and press start. Make sure our door's closed. Okay. You doing okay, Miss Yarn?
Mm-hmm.
All right, great. All right, make sure we've got our drops going. Looking good, okay?
Thank you, Heather.
Sure. All right, Miss Yarn, here's your call light, and let me know if you have any questions, okay?
Okay, thank you.
I'll be back.
Thanks, Nurse Heather.
All right.
Heather, thank you so much for demonstrating a safe medication administration. I
Sure.
just have a couple more questions for you, if you don't mind.
No, go ahead.
Were there any pertinent pieces of information you reviewed before administering the client's medication?
We definitely want to check her culture and sensitivity tests and her liver function tests as well.
Mm-hmm.
But they are pending right now, and the doctor did order this. We know she has no hypersensitivity, so we can go ahead and administer it while we're waiting for the labs.
Now, did this information affect your decision to administer the medication?
No, because we know that she needs an antibiotic to fight her infection, and she's okay to take this medication.
And did this information affect how you administer the medication?
No, I administered it IV piggyback as it was ordered.
All right. Thank you so much for answering all my questions. I really feel like I understand this so much better.
Not a problem at all. I'm here if you have any questions. I'm going to go ahead and take some time and document the teaching and everything I did for the patient. Do you want to watch?
Absolutely.
All right, great.
Thanks.